The Senior Companion Program's presentation on mental health and the aging population. It is our hope that by the end of this session, participants will strengthen their understanding of mental health in the older adult population, as well as learn ways to help support older adults who struggle with their mental health. Let us start by defining what it means to have a personality disorder. A personality disorder is a type of mental disorder in which you have a rigid and unhealthy pattern of thinking, functioning, and behaving. A person with a personality disorder has trouble perceiving and relating to situations and people. Personality disorders usually begin in the teenage years or early adulthood and usually persist throughout life. Now let's define mental illness. A mental illness is a condition that affects a person's thinking, feeling, or mood. Such conditions may affect someone's ability to relate to others and function each day. Each person will have different experiences, even people with the same diagnosis. Here are some factors that contribute to mental health and well-being. Number 1, attitudes about self, such as having good self-esteem, being happy with who you are, and having self-respect. Number 2, a purpose in life, being optimistic about the future and having a desire to live a fulfilling life. Number 3, positive relationships, having emotional attachment and support and having a sense of belonging. Number 4, engagement, such as work satisfaction and completing personally rewarding activities. And number 5, basic needs, such as access to food, shelter, and clothing, and access to health care and security. Here are some facts you should know. Older adults are more likely than any other age group to have complex health conditions, substance use disorders, and cognitive impairments. Loss is common. Loss of spouse, friends, physical functioning, independence, and purpose. And purpose affects overall health, including mental health, physical health, and substance use. Healthcare providers and older adults often mistake depression for a natural response to aging. This can lead providers to not screening for or treating depression. Older adults do not seek help, and older adults go to see their primary care physician to get all their medications and help for their physical illnesses. Between the years 2015 and 2050, the aging population of those over 60 years old will increase from 12% to 22%. Mental and neurological disorders makes up 6.6% of disabilities among older adults. In over 50-year-olds, 15% have a mental disorder, 7% have depression, 5% have dementia, 3.8% have anxiety, and 1% has a substance abuse disorder. So what exactly is depression? Well, it causes feelings of sadness and/or a loss of interest in activities you once enjoyed. Major depressive disorder lasts for at least 2 weeks and affects a person's emotions, thinking, behavior, and physical well-being, and the ability to work and have satisfying relationships. The emotions that often come with depression are sadness, anxiety, guilt, anger, mood swings, lack of emotional responsiveness, feelings of helplessness, hopelessness, and irritability. The behaviors that come along with depression are crying spells, withdrawal from others, neglect of responsibilities, loss of interest in personal appearance, loss of motivation, slow movement, and use of drugs and alcohol. The thoughts that come with depression are often frequent self-criticism, self-blame, pessimism, impaired memory and concentration, indecisiveness and confusion, tendency to believe others see one in a negative light, and thoughts of death or suicide. And the physical things that come along with depression are fatigue, lack of energy, sleeping too much or too little, overeating or loss of appetite, constipation, weight loss or gain, headaches, irregular menstrual cycle, loss of sexual desire, unexplained aches and pains. Anxiety is actually the most common and perhaps the least understood of the mental health disorders. Anxiety is a feeling of fear, dread, and uneasiness. People with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. The physical signs and symptoms of anxiety can include cardiovascular, pounding heart, chest pain, rapid heartbeat, and blushing; respiratory, fast breathing, shortness of breath; neurological, dizziness, headache, sweating, tingling, and numbness; gastrointestinal, choking, dry mouth, stomach pains, nausea, vomiting, and diarrhea; and musculoskeletal, muscle aches and pains, especially in the neck, shoulders, and back; restlessness, tremors and shaking, and an inability to relax. When it comes to psychological signs and symptoms of anxiety, you may experience unrealistic or excessive fear and worry about past and future events, mind racing or going blank, decreased concentration and memory, indecisiveness, irritability, impatience, anger, confusion, restlessness or feeling on edge or nervous, fatigue, sleep disturbance, vivid dreams. Behavioral signs and symptoms of anxiety may be avoidance of situations, obsessive or compulsive behavior, distress in social situations, and phobic behavior. Some barriers that may be leading to poor mental health in the older population include social isolation and loneliness. Older people are lonely and are marginalized and excluded. Discrimination and other human rights violations. Older patients are impacted by lack of control over their life. Physical health conditions. Older patients experience physical health challenges that affect their mental health. Inexistent or inadequate services or support, cannot access or afford services and lack proper support during interventions. Poverty, lack of enough to afford basic necessities. Inequalities, there is disparity in minority ethnic groups that affect mental health. And elderly abuse, whether it be verbal, physical, financial, or psychological. Some causes and risk factors for poor mental health in the older population include physical disability, long-term illness such as heart disease or cancer, dementia-causing illness such as Alzheimer's disease, physical illness that can affect thought, memory, and emotion like thyroid or adrenal disease, change of environment like moving into assisted living, illness or loss of a loved one, medication interactions, alcohol or substance use, and poor diet or malnutrition. 10 symptoms to look out for are sad or depressed moods lasting longer than 2 weeks, social withdrawal, loss of interest in things that used to be enjoyable, unexplained fatigue, energy loss, or sleep changes, confusion, disorientation, problems with concentration or decision making, increase or decrease in appetite, changes in weight, memory loss, especially recent or short-term memory problems, feelings of worthlessness, inappropriate guilt, helplessness, and thoughts of suicide, physical symptoms that can't otherwise be explained, aches, constipation, etc., changes in appearance or dress, or problems maintaining the home or yard, and trouble handling finances or working with numbers. So what are some relevant interventions for those experiencing these symptoms? Well, early diagnosis of mental health issues and dementia allows optimum management of long-term symptoms. Also, it helps to improve mental and physical health, well-being, and functioning. So you may focus on physical exercise, improving activities of daily living and cognitive skills, group support, and social activities. Make sure to identify and manage any related physical conditions, provide information and other support to caregivers, and managing behavioral changes. But as far as interventions go, what can you do today? Well, start a conversation with someone you are concerned about. Maybe say, I'm worried about you. How can I help? Or you don't seem like yourself. I'd like to listen if you want to talk. Or I'm here for you if you'd like to talk. I haven't seen you in a while. Everything okay? You are not alone. I'd like to listen. Remember that when confronting someone you are worried about, To use I statements instead of you statements. For example, instead of saying, "You never met me at our agreed upon spot," say, "I worry about you when you are not at our meeting spot." And instead of, "You make me wait outside in the freezing cold for 30 minutes every time I visit you," say, "I am concerned about you when you don't answer your door." Another good communication technique would be reflective listening. This is when you listen to what the person says, what's important and true for them, listen to the feelings behind the words, no invalidating or arguing when you hear the statement, because there is no one right response to any situation. This kind of listening can ease their stress, calm them down, and create a connection. Create a sense of trust and connection, which can make it easier to have a conversation and learn what is concerning to them. Most likely, they will come to you in the future. You are not agreeing, you can only reflect on their feelings. It does not focus on our feelings or beliefs, but instead focuses on theirs. Let's define what being supportive means. Being supportive means treating the person with respect and dignity. Don't blame the person for his or her symptoms. Have realistic expectations. Be patient because you might have to repeat yourself. Offer consistent emotional support and understanding. And keep it simple. Only discuss one topic at a time and be concrete. Some other ways to be supportive are by providing practical help, offering information and reassurance, because often people just want to feel heard and for you to listen. When you do respond, talk in a soft, calming voice with clear, direct, and short sentences. Remember that not every statement requires a response. Don't argue or get in a power struggle. It can also be helpful to allow extra time for a response and agree to pause the conversation. Keep the level of stimulation low so they can listen and understand. Use non-threatening posture and don't block exits. Be pleasant yet firm. Do not make promises that you cannot keep. Now that we've talked about what is supportive, let's go over what is not supportive. Do not tell the person to snap out of it. Do not be hostile or sarcastic. Do not adopt an over-involved or overprotective attitude. Do not nag the person to do what he or she would normally do. And do not trivialize the person's experiences. Do not belittle or dismiss the person's feelings. Avoid speaking with a patronizing tone, and resist the urge to try and cure the person. So what can you do for someone who is in crisis? Well, you can ask the hard questions. Don't leave them alone. Call the 988 Suicide and Crisis Lifeline and go to the nearest emergency room or call 911. It's also important to assess for risk of suicide or harm. Ask the person, are you feeling suicidal or homicidal? Are you going to hurt yourself or another? And do you have a plan? Many people have suicidal ideation on a regular basis. Asking someone if they are suicidal does not put the idea into their head. There's often relief when someone asks these questions and shows concern. Let's talk about some local resources for you on mental illness. There's the National Alliance on Mental Illness, or NAMI. This is a grassroots mental health organization dedicated to building better lives for those affected by mental illness. They serve Will and Grundy counties, and you can contact them using the information listed on the screen. The Iroquois Mental Health Center offers community mental health services for residents of Kankakee. They also have an office that serves Iroquois County. The Helen Wheeler Center provides outpatient mental health services for managed care recipients. They serve Kankakee County. Here are some crisis hotlines, and remember that if someone is in immediate danger, always call 911. Please let us know if you have any questions, comments, or concerns. And thank you for watching.